Okay, I expect that more audience members will trickle in as we get started, but I do want to get us started on time. So let me welcome you officially. My name is Steffi Hamann. I am an assistant professor and faculty member at the University of Guelph Institute of Development Studies. And first of all, I want to thank the Canadian Association of International Development Professionals for hosting us today. Most of you will know that CAIDP is a nonprofit that has been around for almost 30 years now, and it's run for and by volunteers who give voice to the concerns and interests of the community of Canadians who work in the international development sector. It is my genuine pleasure to welcome you to this webinar and to the presentation of results from a research project that's not only of crucial interest for anyone in our sector, but which is also extremely timely. The report is titled "The Impact of the COVID-19 Pandemic on the Canadian Humanitarian and Development Sector." And it came about in response to important questions concerning the impact of the ongoing global pandemic on the operations of Canadian agencies that are involved in efforts to promote international cooperation and development around the world, and also to learn about how they coped with these new challenges. It was a mammoth effort to pull off in a time of physical distancing because it gives voice to more than 150 different organizations in the Canadian international development landscape. Now, the research was funded by the University of Guelph's COVID-19 Research Development and Catalyst Fund, and it was co-authored by a team of scholars from the University of Guelph. The lead author, Dr. Andrea Paris, worked alongside with Professors Craig Johnson and Spencer Hansen, and with the assistance of University of Guelph students Asa Coleman and Janine Otto. They're all here with us today, I believe, and Dr. Paris will give us an overview of the results of their investigation. She's an assistant professor at the Department of Political Science at the University of Guelph, and as a cross-disciplinary scholar, she has done a lot of work in the past on the history and on the politics of the aid sector. She's the author of a recently published book on the topic. It's titled "Moral Obligations and Sovereignty in International Relations, A Genealogy of Humanitarianism." I am also extremely pleased to welcome Professor Rebecca Thiessen and Jean Lowry, who joined us as experts and discussants today. If you are a member of the international development community in Canada, either as a practitioner or as a scholar, you may not actually need an introduction because both of these women are well known to us and they have certainly left a significant mark in this field. Jean Lowry is the president of CAIDP and comes with a long list of accomplishments. With decades of experience in the international development sector, she has lived and worked in various countries ranging from the Philippines to Barbados, and she's led publicly funded development projects around the world, especially in sub-Saharan Africa. She's currently the director of the READY project at the University of Waterloo, and she represents CAIDP on the COVID-19 Dialogue Group, which provides input and advice to Global Affairs Canada as we try to meet the new challenges brought on by the global health crisis. Rebecca Thiessen is a full professor at the University of Ottawa, where she serves as the university chair in teaching and as the associate director and coordinator in the School of International Development and Global Studies. Her research work investigates the role of Canada and Canadians in the world, with a special focus on gender dynamics. While she's widely published in reputable scholarly journals and books, she manages to truly connect scholarship and international development practice in all of her work. Thank you to our panel members for sharing your insights with us today, and welcome to our audience. I am so pleased to see so many of you as more and more make your way into this seminar and that you were able to join us and make time for us today. This webinar is scheduled for 90 minutes. We will begin with a brief overview of the research findings by Andrea, followed by a commentary by Rebecca and Jean, who will put the specific findings of the project into a broader perspective. Now, there's a reason we went public with this process, because we invite you, our audience, to follow along and chime in as well. And before we get started, we'd actually like to get a sense of who is present today. And we prepared a little poll to ask you to just take a quick moment to tell us what your background is. So Nicole, if you wouldn't mind, could you start our first poll so that everyone has an option to answer. So just select which of these options best describes you. Do you work for a nonprofit NGO? Do you work in the public sector? Are you a researcher or academic? Do you work for a private sector or nonprofit organization, or are you a member of the general public? I'll give you just a couple of seconds to pick your response. And then I'll ask Nicole to close the poll now so that we can see what the responses were that came in. Here we go. We see that, okay, so most of you, I see this here, 40% are members of the nonprofit sector. Then we have quite a few researchers and academics, but we also have representatives from the public sector, from the private sector, and from the general public. So I'm so happy to see a wide mix of audience members, and I hope for a lively debate or discussion with you afterwards. So now we've practiced the interactive aspect of this webinar already, and I will open the floor for questions after the presentation by Andrea and the comments from our panelists. And so then I encourage you to use the questions feature that you see on your screen to formulate any questions that you have. That will help me and us keep track of the conversation and allow our speakers to dig a little deeper into any issues that are of particular interest to you. Now, without further ado, let's get to it. I'm sure we're all curious to hear what Dr. Paris and her colleagues have uncovered, and I'll ask the other panelists to mute their microphone during this presentation, and I'll do exactly the same. So, Andrea, the virtual floor is officially yours.
Steffi, thank you so much for the introduction. Although we're gathered today in a virtual space, we come from various corners of this country and possibly beyond. I work at the University of Guelph and currently live in Toronto. But it's important to recognize that all of Canada resides on traditional unceded or treaty lands of First Nations, Inuit, and Métis peoples. I would like to begin by acknowledging the Attawandaron people on whose traditional territory the University of Guelph resides, and offer respect to our Haudenosaunee, Anishinaabe, and Métis neighbors. The University of Guelph is in the Dish with One Spoon territory, and it is located on the treaty lands and territory of the Mississaugas of the Credit, and on territory that belongs to the Between the Lakes Purchase Treaty 3. I'm very excited to be able to present our research findings to you all today, as well as for the opportunity to hear your questions. This is an enormously complex topic in an enormously complex time, and the research that I'll be presenting today represents just a first step in trying to identify some of the big issues and trends within the Canadian humanitarian and development sector's response to the COVID-19 pandemic. I anticipate that, unfortunately, this is only the beginning of our efforts to understand the implications of the pandemic for the sector, but more importantly, for understanding the true scale of the impact that the pandemic has for the many global issues that concern us all beyond COVID-19, including global poverty and inequality, climate change, conflict, food insecurity, to name only a few. And Nicole, I'm having trouble advancing to my next slide.
If you can click, Angie, then maybe Nicole can do the clicking.
Yeah, go ahead, Nicole. Thank you. And maybe you can give me mouse control again. Before I begin to discuss the research, I would like to acknowledge and express gratitude for the many people that made this research possible. As Steffi mentioned, I'm part of a large research team that consists of Dr. Craig Johnson, Dr. Spencer Henson, and two absolutely superstar research assistants, Asa Coleman and Janine Otto, all of whom have displayed incredible persistence, creativity, and diligence in pursuing this project under tight time constraints. I'd also like to thank the 151 organizations who contributed their time and thoughtfulness when participating in our surveys and interviews. As Steffi mentioned, our research was made possible through funding provided by the University of Guelph's COVID-19 Research Development and Catalyst Fund. And finally, last but not least, I want to offer a special thanks to CAIDP for the collaboration on this webinar. Noel Milson and Nicole Lagourier in particular have worked extremely hard in getting everything organized for today. Thank you also to Jean Lowry and Rebecca Thiessen for reading a draft of the report with just a week's notice and preparing some comments for today, and also to Steffi for keeping us all organized and on track. The research that I'm presenting today will be available to you all by the middle of November, when we will officially release our research report. The report is currently just over 40 pages, not including appendices and references, so it contains a lot of information. In the time we have today, I'm going to present some of the main findings from the report, but this is by no means a summary of the entire document. I'm going to start by framing the presentation with the questions that guided our research, and then I'll give you a quick overview of our research methodology. I'll provide a brief overview of our research participants, and then the remainder of the presentation will focus on the challenges and impacts experienced by Canadian NGOs and their strategies and responses to these challenges. I'll then conclude with some tentative recommendations. I say that these are tentative because I'm excited and interested to hear both from the other two panelists, but also you, the audience members, about what they and you believe would be the most useful recommendations after you hear the research results. The aim of our project was to investigate the impact and implications of the COVID-19 pandemic for Canadian humanitarian and development organizations. Canadian NGOs play crucial roles in supporting public health, climate action, poverty alleviation, human rights, gender equality, food security, and education, amongst other important issues. When the pandemic began and we decided to start this research, we knew that the pandemic would disrupt how Canadian organizations delivered these services and engage with their global partners, but we didn't know how and to what extent. Additionally, we assumed that the economic costs of the pandemic would threaten to undermine the future viability of the sector. But again, we didn't know the extent of these threats. Even more concerning is that we understood that all of this would have a negative impact on communities in the Global South with whom Canadian organizations work. But again, we had no hard data on how and to what extent. We decided to focus on collecting data at the level of organizations rather than from individuals working in the sector in order to try to understand all of this, with the end goal of collecting high-quality data that would shape the report's recommendations for future policy responses. Our research employed a mixed methods, quantitative and qualitative approach, employing a survey followed up by semi-structured interviews. The survey was designed, distributed, and analyzed on the Qualtrics platform. Its 59 questions were divided into 3 sections. The first section collected background information about the organizations being surveyed. The second section examined how the pandemic had impacted them, their impacts and challenges. And the third section collected information about how organizations had responded to these challenges. We distributed the survey via direct email invitations to one representative within each organization and collected one survey response per organization. It's important to keep in mind that our collection of survey responses began on July 8th and basically ended on July 31st. A couple extra surveys trickled in the 2 or 3 days after that. So the information provides a snapshot of what was happening in the sector during the month of July. We realize that everything is changing rapidly in the current context, but this provides us with a baseline of what was happening in the sector during the pandemic's early stages. In total, we sent out 745 surveys and received 151 responses, amounting to a response rate of 20.3%. After the completion of the survey, the research team identified a cross-selection of interview participants that would provide a diversity of perspectives. We also selected interview participants based on their survey responses. For instance, if they had indicated their organizations had experienced severe funding losses, or if they had significantly restructured their programs. In total, we conducted 13 interviews between August 1st and September 11th. So who were our participants? We thought it would be really important to collect information related to organizational size in order to see if the pandemic has had different kinds of impacts on small or large organizations. The survey itself provided several budget brackets, but during the analysis, we used that with the information we collected to classify organizations as either a small or medium organization, an SMO, or as a large organization. SMOs were categorized as organizations with an annual budget less than 10 million, while large organizations were categorized as those with an annual budget greater than 10 million. We also used Schedule 2 data from the CRA to confirm that none of the organizations that we had classified as SMOs had overseas expenditures greater than $2 million. So what we see here is that our pool of respondents provides a pretty decent reflection of the overall NGO sector in Canada in terms of size, which is made up of a pretty large number of small and medium-sized organizations and a much smaller number of large organizations. You'll see that here the total number of respondents is 149. We received 151 total surveys, but 2 respondents chose not to disclose their budget size. So this data was based on a number of 149. Our survey also tried to get a sense of where NGOs are getting their funding, as well as their level of reliance on these different funding sources. The majority of our organizations who relied on personal charitable donations as the primary source of funding, with 123 claiming this as a funding source. The next most prevalent funding source was that received from philanthropic foundations, followed by corporate donations, followed by funding from Global Affairs Canada. In terms of similarities between SMOs and large organizations, there were similar proportions of SMOs and large organizations indicating they were very reliant on personal donations. The choices were very reliant, somewhat reliant, or less reliant. But we identified some relevant differences between SMOs and large organizations. A greater proportion of SMOs indicated they were very reliant on philanthropic foundations compared with large organizations. Conversely, large organizations were much more likely to receive funding from Global Affairs Canada compared with SMOs, which is unsurprising given that large organizations simply have greater capacity and experience putting together proposals to GAC. In summary, there are 3 things to take away from this. 1, our findings indicate that overall, organizations rely on personal donations more than any other funding source by a pretty wide margin. 2, SMOs are more likely to rely on funding from philanthropic organizations in comparison to large organizations, while large organizations are more likely to rely on funding from GAC in comparison with SMOs. And 3, I think this is less of a finding and perhaps a suggestion that deserves a bit more research, but our evidence suggests that in general, SMOs have a less diverse funding portfolio to rely on, which becomes important if you're relying on one source and the money from that source dries up. Finally, we asked respondents to identify their thematic areas of work over the past 5 years. Across all respondents, education and gender equality were the thematic areas most frequently cited as areas of work, with 91 organizations working in the area of education and 90 in gender equality. I think this table provides a really nice snapshot of the thematic distribution of effort across Canadian NGOs. Notably, education emerged as the main thematic area where SMOs are engaged more frequently. Conversely, 81% of large organizations engage in gender equality programming, while only 54.7% of SMOs engage in gender equality programming. A possible explanation for this difference is that large organizations who are more likely to receive GAC funding are required to include gender dimensions in their proposals due to FIAP guidelines. Or quite simply, large organizations may simply have more capacity in this thematic area than SMOs. Now I'm going to turn to our findings related to challenges and impacts, beginning with funding losses. Our findings suggest that financial loss within the sector since March 2020 has already been significant. Of the 146 respondents who chose to answer the survey's question about whether their organization had experienced a decline in funding since March 2020, 60.1%, or 89 organizations, indicated a decline in funding. This rate of loss was consistent between SMOs and large organizations. The average decline in funding across all organizations was 26.4%, with the greatest number of organizations experiencing a loss between 21 to 40%. It's important to know the limitations of our data related to the exact percentage of funding decline. We found in follow-up interviews, respondents clarified that the percentage decline they had identified in their answer in the survey was based on projected losses for the entire 2020 fiscal year, while others specified that the number they provided was for a fiscal quarter. Other respondents indicated that the number they provided in the survey about loss doesn't actually or adequately capture the extent of loss they are experiencing, since it doesn't include various forms of in-kind support that ceased at the onset of the pandemic. Many respondents indicated that the true extent of financial loss will not be understood until closer to the end of the fiscal year. So this number, 26.4%, is at best a projection based on the collective projections of our respondents. Nevertheless, even as a projection, it is a funding decline that is consistent with funding declines that have been identified in other surveys carried out by Bond in the UK and the DevEx Trends Tracker. Our findings also provide a snapshot of the funding sources that are of greatest concern. As I mentioned a few moments ago, the majority of respondents indicated that they relied upon personal charitable donations, with a large number indicating that they were very reliant on that source. As we expected, charitable donations were also the most frequently reported source of funding decline across the board, unsurprising given the extent of unemployment and the major economic impacts across the country. Moreover, of the 102 organizations who indicated that they were very reliant on personal donations as a funding source, 52% indicated a loss from personal donations. So in this sense, funding losses from personal charitable donations are particularly damaging for organizations who are very reliant on them. As this table shows, declines in funding from corporate donations and from philanthropic foundations were the next most significant source of loss, although these are not as extensive. Losses from GAC funding disproportionately impacted large organizations compared with SMOs, also unsurprising given that they were more likely to receive GAC funding. Our interview participants specified that GAC losses were mainly related to programs that had already been approved to receive GAC funding on a cost share basis, but whose implementation was suspended or canceled due to pandemic-related interruptions. In such cases, organizations were unable to recoup their funding because they couldn't implement their project as it was proposed, despite the fact that they still have to manage fixed administrative costs, whether or not the program actually gets implemented. The survey asked respondents whether their organization had had to temporarily or permanently suspend program delivery as a result of the pandemic, as well as to identify the thematic areas of those suspended programs. 39.7% indicated that they have had to temporarily suspend programs. This impact was experienced fairly consistently across organizations of different size, but there were some key differences between SMOs and large organizations. A much greater percentage of SMOs indicated that they have had to reduce their budget for program delivery compared with large organizations. SMOs were also slightly more likely to indicate several or many program suspensions compared with large organizations. Respondents were asked to identify the main reasons for temporary program suspensions, and it was public health concerns and government restrictions were cited as the most frequent reasons for program suspensions, followed by travel restrictions. I think one of the most important findings of our research is in relation to the kinds of programs that are being suspended. As I mentioned a moment ago, education and gender equality were the thematic areas most frequently cited as areas of work. It's important to note that of the 60 organizations who reported temporary program suspensions, education was by far the largest thematic area impacted. Gender equality and environmental sustainability related programs were tied at second place. The prevalence of suspensions in the thematic areas of education and gender equality could be attributed to the fact that they are also the most common thematic areas of work. However, it's important to note that the pandemic has had a particularly damaging impact in these areas. As we've seen around the world, education is next to impossible in classroom settings without the risk of disease transmission. Likewise, many have already written about the gendered impacts of the pandemic. From this perspective, the prevalence of program suspensions in the area of gender equality is particularly concerning. Our data suggests that the pandemic has had a double impact on education and gender equality. It has both damaged historical progress that has been made in these areas, as well as negatively impacted the ability of NGOs to address these issues. A pervasive theme within both the qualitative survey responses and the interviews was how the pandemic had served to amplify pre-existing issues or problems. While these issues are not entirely new, they have taken on new significance or scale as a result of the pandemic. The first issue is in relation to how the pandemic has amplified pre-existing development problems, or how it may even lead to reversals and gains. Poverty reduction in particular was cited by several respondents as an area of concern. Several respondents also cited food insecurity as an issue that has been exacerbated by disruptions to production and supply chains, in combination with severe famines and droughts. Finally, participants expressed concern that with COVID-19 taking center stage as a global health crisis, other important issues will not be adequately addressed. The second issue that emerged was the issue related to lack of public engagement. The survey didn't ask any specific questions about public engagement, but this was a major recurring theme that emerged in both the qualitative survey responses and the interviews. Canadian organizations have always faced the challenge of seeking support from a general public that does not necessarily see the value of international engagement or is more focused on domestic affairs. This has become even more the case as the Canadian public experiences the economic and health impacts of the pandemic and focuses on domestic recovery. Now I'm going to turn to our findings about the strategies and responses of NGOs, and I'll start with feminist and gender-based pandemic response. As I mentioned previously, many people have highlighted the gendered impacts of the pandemic. I also mentioned how our findings suggest that gender equality programs have been impacted the most in terms of program suspensions, along with education. Given that research in the early stages of the pandemic had already identified its gendered repercussions, And given that Canadian foreign aid is framed by the Feminist International Assistance Policy, we wanted to investigate the extent to which Canadian organizations had implemented a feminist approach in their pandemic response. We found that only 17.2% of our respondents have implemented a feminist approach. Disaggregating by size, we found that that 14.8% of SMOs had implemented a feminist approach, compared with 35% of large organizations. While further research is needed to determine the exact reasons for this, it's likely related to the differential levels of capacity that I mentioned earlier. Additionally, the large organizations who have higher rates of receiving GAC funding are more likely to have already integrated gender-based programs in their work due to the requirements of FIA. In any case, it's likely that organizations that had already integrated gender-based work or gender-based analyses in their work prior to the pandemic have more capacity to do so within their pandemic response. In terms of the specific feminist approaches that organizations have adopted, the majority have undertaken a gender-based analysis of their pandemic-related programs. Significantly fewer have launched new programs targeting women or LGBTQ communities, and much fewer have undertaken an analysis of how the pandemic has impacted their Canadian or international staff. Now I'm going to turn to localization. The majority of our survey respondents indicated that they had significant relationships with local partner organizations. The pandemic has impacted these partnerships in a number of ways, many of them actually positive, according to our participants. First, international travel restrictions have meant that local partners have taken on even greater responsibilities for program delivery. Some research participants expressed the hope that increased localization will be a positive long-term outcome of the pandemic, as local organizations are ultimately better placed to provide services to their own communities. Despite the significant financial and logistical challenges brought about by the pandemic, research participants expressed some optimism about how it might accelerate some of these positive and overdue changes within the sector related to empowering local actors. At the same time, however, participants also identified some challenges with these shifts. Of course, partners were restricted by lockdowns, or poor internet and phone connections reduced or prevented their ability to continue program delivery or communicate with their Canadian partners. Other concerns were related to the logistics of conducting program evaluations and impact assessment in a remote working environment. But a more systemic challenge was identified. Even when organizations devolve decision-making responsibilities to local partners, the extent to which they can do so is limited by the inflexibilities of CRA regulations around direction and control. While these CRA regulations existed prior to COVID-19, the pandemic has revealed how localization has been hampered by strict and complex administrative requirements. In other words, even though respondents expressed optimism about how the pandemic had highlighted the need for localization and helped to accelerate that process to some degree, they also expressed concern that existing funding structures tend to impede localization rather than support it. Now I'm going to turn to digital strategies. Similar to other workplaces, Canadian NGOs are restructuring their activities to take place online. It's therefore not surprising that 30.4% indicated that their organization was making new investments in digital infrastructure in response to the pandemic. People noted that their organizations were pivoting to remote work arrangements, online fundraising, and online program delivery. While most participants indicated that their use of these technologies was in response to the pandemic, some speculated about the possibility of permanently adopting them in the areas of staff and volunteer training, digital evaluation tools, and capacity building, or even program delivery in the future in a post-pandemic world. Nevertheless, despite this focus on digital strategies, Many respondents also acknowledged the challenges. They reported that online fundraising events had not made up for the financial losses they had experienced. There were concerns about the limitations of transferring in-person programs to an online format, particularly in contexts where these programs might involve personal discussions related to traumatic experiences. Finally, and perhaps most importantly, respondents expressed concern that moving their organization's activities online would contribute to and even exacerbate a pre-existing digital divide. Digital strategies are only available to those organizations that already have a decent digital infrastructure or are capable of building one. They're more difficult to implement for those organizations without the human resources or finances to invest in these areas, and nearly impossible to implement in geographical locations that lack robust infrastructure. Many local partner organizations work in remote areas with no computers or limited access to internet, so this would impede their ability to shift their programs online and therefore impede the process of localization that I discussed a moment ago. Likewise, the vast majority of people living in poverty lack access to digital resources. In other words, even though NGOs are using digital technology as a means to ensure their own survival, the long-term impact of this shift may be to make their services and programs even more inaccessible to those who need them the most. COVID-19 has laid bare some of the underlying tensions, inconsistencies, and inequities within the sector that have been hidden in plain sight. The pandemic has exposed both the importance and centrality of local partners, as well as the structural barriers within Canadian institutions to empowering them further. It has exposed the gap between rhetoric and reality when it comes to implementing gender-based policies. It has exposed how the sector is structured to promote competition amongst its members rather than cooperation. And it has exposed and amplified how global problems cannot be disentangled from each other, from climate change to poverty, to gender, to health, which necessitates much higher levels of collaboration at all levels of the sector. The pandemic has forced NGOs to rethink everything about how they operate. While our respondents expressed a great deal of fear and uncertainty about the future of Canadian humanitarian and development organizations, there was also a note of hope about the opportunity it creates. This opportunity is perhaps short-lived and is offered within a context of unprecedented global volatility, which makes it all the more important that this conversation starts now. Our hope is that this research acts as a starting place for this conversation by exposing both the challenges and the opportunities for Canadian organizations to not only survive the pandemic, but to be better for it. To conclude, I want to offer my list of tentative policy recommendations. I say these are tentative because, again, I want to use this opportunity to test them out before putting them in the final version of the report. I would be happy to hear from you all about whether you agree that these are the most important or whether they should be revised in any way. I'm also eager to hear of other recommendations that I haven't listed here. So first recommendation is targeted funding to support SMOs. This is to support the organizations that appear to be the most vulnerable to financial crisis, as well as to preserve the diversity within the sector that SMOs bring to it. Second recommendation is to target funding to support education and gender equality programming. This also includes capacity building for SMOs that have not been able to include this in their program portfolios. Three, to maintain funding for non-COVID related programs and services. There is no question that there will be significant long-term harm if funding is diverted to COVID-19 response and other issues are ignored. 4 is to restructure funding regulations to better support local empowerment. I know that this is a sticky one, because here we run into issues around local capacity and accountability. But we need to have this conversation about what is the role of Canadian NGOs in relation to their local partners. How can we best support local empowerment, and how can financial regulations in Canada be restructured to facilitate this? And 5, we need to pursue smart digital investment that does not contribute to worsening the digital divide. Again, this is a sticky one because I'm not suggesting that everyone and everything should be going digital, and we need to pay attention to the big picture long-term impact here. However, in a post-pandemic world, digital infrastructure will be able to help us avoid unnecessary travel that contributes to the climate crisis. There may be ways to make this work, but it has to be done with an eye to equity at all stages. So thank you. I'll leave it here. Thank you for the opportunity to present this work, and I look forward to your questions.
Thank you so much, Andrea, for this short but very comprehensive overview. I'm now going to hand it right over to our 2 expert panelists for their response and reaction to this finding. And so after that, we'll have the chance to address some audience questions as well. You can go ahead and enter your questions in the question feature at any time. I'll collect them there. We will start with Rebecca Thiessen. Rebecca, what are the findings that stood out to you from this report as you went through the draft? You are, among many other accomplishments, a feminist scholar. Did you take special note of the gender implications, for example?
Great, thank you so much, and thank you to the team, CAIDP and Andy and the authors for inviting me to comment. It's a great opportunity. It was an excellent report with some really broad-ranging impacts and implications of the pandemic on CSOs and NGOs, and also the implications for our partner communities. There's an impressive amount of data, useful feedback, and an outstanding analysis in this draft report. And it was all done so quickly, so congratulations to the author. So 2 things that stand out for me. The first is the suspension of programming around gender equality. So that finding of gender equality suspended programming around 31.7% overall. I do find this particularly concerning, and especially in light of the government's prioritization of feminist policy, gender equality, and women's empowerment, combined, of course, with the clear gendered impacts of the COVID crisis in care work that Andy really pointed out quite well in her presentation, and it's even much more clearly explained in the report, where we can think about some of the gender impacts of the pandemic, including increasing rates of domestic violence against women, higher rates of unemployment amongst women, women having taken on more caregiving and domestic responsibilities, even if both partners are working from home, and so on. So really, we need to know more about why and how the pandemic is impacting the ability of NGOs to address these issues. What strikes me about this is how quickly gender and feminist approaches fall away in the tyranny of the urgent in emergencies. And we can see similarities in this historically in disaster and humanitarian crises. Yet for decades now, gender mainstreaming work and other gender-focused emergency programs have provided evidence of the urgency of focusing on gender relations at the onset and the gendered nature of emergencies and responses. So this challenge raises important questions about the nature of our commitments to feminist policy and practice. And I think it's a moment for us to reflect on how well we've learned from past experiences and to consider what are the unique experiences that we have in the COVID pandemic context. The other interesting finding that I observed and have been reflecting on from this report is this increased localization or increased local ownership. So the report explains the possibilities for increased local ownership, seeing this as positive according to many of the research participants. So we can see this in terms of the increase in travel restrictions, reduced travel, and what that's meant that for local partners having to take on greater responsibilities for program delivery. As one of the interview participants said, we rely on them, our partners, to a much greater degree now in terms of doing the actual work on the ground. Some research participants expressed the hope that increased localization will be a positive long-term outcome of the pandemic, as local organizations are ultimately better placed to provide the services to their own communities. And they might also accelerate some positive and overdue changes within the sector related to empowering local actors. And I think we can also think about this in the context of a feminist approach to doing development practice. If localization is a significant outcome of the pandemic and increased autonomy and local ownership results, we need to study this closely and find ways to build on the successes, reduce some of the challenges, and to scale up where we have positive outcomes. This has long been a goal of international development efforts, and of course, explained also as part of feminist principles. So now is an opportunity, I think, to turn this goal into a reality. Other studies around the world are also observing this new dynamic. In a study by ACAPS, they argued that the limitations on the movement of aid workers means that international organizations and research institutions have to find ways to transfer more responsibilities and decision-making into the hands of local staff and partners. Leveraging the power of the internet to implement programs remotely, the current circumstances are an opportunity to create a more flexible, collective, and collaborative leadership and management. So this is helping us think about shifting to more locally led delivery, which harnesses in-country expertise, places that have the expertise and the potential to enhance their long-term effectiveness of responses and contribute to the sustainability of programs. This also can create more inclusive and participatory forms of governance. And many hope that this will encourage open dialogue and reinforce local and national action wherever possible. So considering some of these challenges to increase local autonomy, though, requires us to rethink the financial models and the monitoring and evaluation processes that were commonly used in the pre-COVID times. We also need to consider the challenges of reduced public support for international programming on COVID that could hamper some of these programming. So these are some of the context-specific things to consider. The management of delivery of funding, monitoring and evaluation, and financial accountability mechanisms will need to adapt. The authors of the report found that in this current context, the NGOs have had to find creative ways to adapt their programs in response to COVID-19 restrictions. In fact, a lot of reports that are talking about the impact of COVID-19 have reinforced some of the benefits around innovative thinking and creativity that has happened as a result of COVID-19. Capitalizing and learning from some of those experiences might be a useful moment for us as well to think about how we can also adapt in ways that are more effective and efficient for our partners. In remote work contexts where it's impossible to perform monitoring and evaluation in person, it is more complicated, and it can be burdensome to ensure that financial compliance is accounted for with local partners. And as one person in the report noted, we need to ensure that basic bookkeeping is kept up. There are few digital systems at the front lines. The places we work are very far off, even with improved computer access. So these are real concerns that our partners are experiencing. There are also concerns about rigid regulations on how the funding can be used and how that impedes the ability to respond creatively to the pandemic. So we are encouraging and fostering and hoping for creativity and innovation in our programs, but that is sometimes limited by the rigid regulations that many of the organizations in this study highlighted, limitations that come often as a result of the Global Affairs Canada funding models that they have. So nonetheless, it's an important opportunity for Canada to become more innovative in its approach to monitoring and evaluation so that local ownership continues and expands. But it's also a concern in terms of the nature of the relationships that can develop and the limited role for transnational actors, including international development volunteers, for example, who've had their programs ended short or have been redirected to virtual volunteering or have had their placements canceled. So some of the research that we've been working on over the last few years in 19 countries show that the collaborative work carried out by international development volunteers who spend often 6 months to 2 years in country, that work, that time spent together is important for building capacity, for mutual learning, and for knowledge sharing. And in some of our findings, we found also that it's been important for public education. those transnational actors, those international development volunteers return to Canada and are able to advocate in Canada for the kinds of changes that their partner communities wish to see. So while the local ownership has value, we need to capitalize on that and make that a priority. The impact of reduced time spent working collaboratively, is still unknown and of great concern. So those are some of my first responses to that question.
Thank you so much, Rebecca. Lots of food for thought to digest for us, both in terms of gender implications and certainly in terms of localization impacts. I'm also curious to hear from CAIDP President Jean Lowry about her impressions from a more sort of practitioner's perspective. Jean, what were your main thoughts and concerns in light of this report? Did you see an amplification of existing challenges in the sector? I think you're still muted. I made you mute yourself.
Okay, all right.
There we go.
Oh, that discussion we just had about technology. Anyway, thank you so very much. Yeah, I definitely had some thoughts. I first wanted to acknowledge and just shower praise on the team that managed to pull this off, because the ability to get this kind of data in such a short period of time is extraordinary. And I think the work that you've done in terms of interpreting it is just, it's excellent. So it's been a real privilege to actually have a chance to read the preliminary report and contribute to this discussion. And I just, the other points that I think that I want to kind of make are falling out of part of what Andrea is saying and out of what Rebecca is saying. So I'm going to try and sort of skip some of the stuff that I was going to say. I want to point out first that CAIDP, I represent the private sector, but I spent many a year in the NGO sector. So what I've been doing while I was reading through the report was saying, okay, yeah, I get that the most of the data is coming out of the NGO sector, but there is some of the private sector data there. So what are the what is the things that are common between us? We don't have philanthropic donors. We don't have a fundraising campaign in the private sector, but so many of the findings were applicable that I just was quite struck by that. So I start, I think I want to kind of just bring us all back to some of the early research that the team did in terms of the development context. We all know that the ODA commitment in Canada has for years been well under the 0.7 GNI target, downwards around 0.26%, I think is probably more appropriate. And as aid priorities have shifted from government to government, the long-term partners have been left behind. So when I think about what you're saying about localization, it's all good, but we've already abandoned partners that were extraordinarily good because we've shifted from what they were good at, let's say food security, to gender or climate change or something else. So it's not consistent. We have in fact lost ground in that sense. The private sector, the NGOs, CSOs, whatever you want to call it, we're all competing for the same dollar. The differences between us used to be obvious. You know, we could actually say, well, this funding set is for the NGO sector, or this funding set is for academia. Now we're all just one big mash, and we're fighting for the same dollars, and that dollar is going down. The new approaches that were being suggested prior to COVID are not new. They've been around the world for 10, 15 years, like blended finance. But in Canada, we had only just gotten started, and the rollout was complicated. And to the best of my knowledge, not much has actually been released at all in that. Hang on, just trying to get to my. Okay. Now, the comments that Andrea was making with regards to the impact of loss of GAC funding for large organizations, that would have applied the same to the private sector as it would to the NGO. That's a huge loss because you're still carrying your costs, your administration staff, your cost of your telephones, it's all still there. So there's nothing changed. And what GAC did with COVID was pivot and top up the organizations that had applicable and relevant projects that could do so. And I believe we will hear fairly soon about what those numbers are and who got that money. But I have to question the transparency of that, because unless you've talked to somebody who's got some of that money, it's not out there yet. You know what I mean? So I think there's a bit of COVID has brought a degree of adaptability and whatnot to the whole scenario that has been extraordinary, particularly on GAC's part. The minister has been very good with her time in terms of the town halls. It's just above and beyond what anybody could expect. That being said, there's only one RFP posted on the GAC website. We're told that there was more coming, but I'm a little worried about that, guys, because quite frankly, the competition is going to be ugly. So when you think about all of these organizations that have failed, are suffering from financial issues, competing against the bigger NGOs and private sector organizations that have proposal writing machines, bon chance on that one. So we have, as coalitions, all of the associations, CCIC, CanWatch, Climate Change Network, all of us have sent messages to Global Affairs Canada, to the Prime Minister, the PMO, and basically saying, please stop giving all of the money to the IFIs, the ADBs, the IADBs, because that money could be used here. We can use that money much more effectively and put a Canadian stamp on it. You don't need to just shuffle it off over there, and then because it's easier. And I want to just pick up on that point that it's easier, because it's partly easier just to give big chunks of money, like $250 million over to the ADB, because as part of the last evolution over the last 5 to 10 years of Global Affairs Canada, a lot of the specialists that had the capacity and capability for developing and designing RFPs and proposals and projects are gone. They've retired, they haven't been replaced, there's new structures in place. So you have to start looking at, okay, well, you've got this huge talented group of people in the form of CSOs, NGOs, and people within the private sector who are more than capable of designing and developing projects. However, how do we do that? Okay, so I want to move on to the funding losses. We're going to definitely have a major long-term impact. This is going to be 3 to 5 years out. I can't put a hat on and say, 6 months from now, we're going to be doing this. It's like, I don't know either. But what I can guess is that we aren't going to see any real impacts for another year or two when things start shuffling out, when you wrap up the projects you're doing now and there's nothing in the pipeline. There's something in the pipeline. I don't know. So the private sector, we did a study about 2 years ago, 2018, I guess, where we asked our membership as to what it was that, where did they get their funding? And at that point in time, it was really unexpected to hear that almost 65–70% of our members actually did not rely very heavily on GAC for funding. So they had already pivoted. They had already moved and diversified away from Canadian sources of funding as just not being reliable. So we have, therefore, this ability to do that. I think that that's been happening, but I cannot say the impact on our private sector and the NGO sector is going to be the same. It's going to be brutal. Okay, we have a problem. We have way too many crises happening at the same time. And this was brought up, I believe, in the report by one of the interviewees that Andrea had. We have AIDS, we have climate change, we have education issues, we have health system, we have violence against women, we have food security, famine, droughts, and we risk not addressing critical issues in just trying to deal with COVID. I'm going to throw another challenge out here, and that is, although we may not see pandemics per se in the same way as we're seeing COVID, what we will have with climate change is a change in the spread of vectors. So you are going to see with climate change insects and diseases that did not have foothold in some areas, all of a sudden starting to build. So you're going to end up with disease issues. You're going to the mosquito-borne diseases in the Caribbean that didn't exist before, like Zika. Those are just symptomatic. But you're also going to have food security issues because of diseases that are now moving and migrating through lack of quarantine into other areas, and we're going to start seeing a lot more of that. We've already spoken about the difficulty in convincing the Canadian public to support international development. We, as the private sector, are not so much affected by that, but it does affect the government's ability to say, okay, we want to put this chunk of money against international development if the Canadian public is not supportive of it. So there is that kind of give and take. Again, we spoke to the localization issue, so I'm not going to go there at all. I'll just move right on to it, to some conclusions I think that I'd like to put on the table. So first off, the impacts are the same on the nonprofit sector as it is on the private sector. There's just different nuances and context to this. It's amplified and exacerbated pre-pandemic conditions as donor governments deal with the domestic economic impact of COVID response. It's likely that contributions to ODA will decline further. And this is across the board, where we're looking to have national government support development efforts. It's going to be a little more focused. The demand, there will have a long-term effect. We know that. It's far-reaching effect. This has demanded responses in approach, everything from, as we see in Andrea's report, downsizing, pivoting, localization, competing for international context. It's all going to change. It's very unlikely, and I'm not being cynical. I just think that this has gone and thrown a huge monkey wrench into the SDGs and the achievement targets. I think we have to relook at those. I don't think we're going to get what we're needed. In the near term, COVID, it's COVID. We have to get past this point. But once there is a vaccine, once we have the ability to move forward, then we have to really focus in on those issues that Andrea pointed out and Rebecca pointed out, which is gender equity and environment and climate change and food security. Those are going to suffer in the short term, and we need to be ready. We need to be ready to pivot and move on those areas. And again, the challenge here is who's going to design those projects, who's going to put those together. Don't expect GAC to throw out a whole bunch of RFPs. It's not feasible. So what is it that we as a sector can do to say, okay, here's a strategy. What do you think? ODA, will it pick up? I think across the planet, yes. I think you're already seeing movements happening. I think you're seeing a lot more that is going to be achieved in the next 6 months to a year in terms of recovery, economic recovery. And because of that, those are going to be focused hopefully on those most hit by this crisis, and that would be women, medium-sized enterprise, small and medium-sized enterprises, those that are heavily involved with women's issues and women's rights, because it's the hospitality sector, the tourism sector. All of this is just taking a massive beating. So I think that's where I'd like to kind of leave off, other than to sort of throw out to the people in this audience. The recommendations that Andrea put forward are just the start of what we need as a sector to present to our donors, not just GAC, by the way. It's to UN donors and to others. What is it that we think would help us solve these problems collectively, and where we can actually work together? We need to not be competing for the same blasted dollar over and over again, NGOs, academia. It just doesn't make sense anymore. So what more can we do? So on that, I'll hand it back over to Steffi.
Thank you very much, Jean. Thank you both for sharing your thoughts. Now I know that our audience members also have questions for you. We had some questions submitted already upon registration, and I think several of them have been answered in quite some detail. But we'll take up some of the other ones in the time that we've left now. And I can't promise that we'll get to all of them, but we'll do our best to address some. And of course, we hope to keep the conversation going even after this live event. While you may still be formulating some questions, we have another poll for you to just summarize sort of your overall impressions. As researchers, we're curious about what kinds of recommendations you think are most important right now, based on your own knowledge and your experience. And after listening to this presentation, we're going to ask you to select from a list that we'll present to you. This poll is going to be divided into 2 questions. They're both the same questions. It's just that we have a limited amount of answer options that we can show you at a time. So from each list that we're going to show you, we'd like you to pick your top 2 priorities. So you can pick multiple answers, but we'll ask you to stick to a limit of 2 per question. So I'll ask Nicole to launch the second poll. And so our first list includes the following options for recommendations that we should give. Should we call for an increase in funding available to Canadian NGOs for the urgent global pandemic response by $2 billion? And we picked that amount because it equals roughly 1% of our total domestic pandemic response. Or should we focus more on providing targeted support for small and medium organizations specifically? Or should we prioritize funding for gender equality programs during this time? Or prioritize funding for education, innovation, and entrepreneurship programming? Or should we maybe limit who is eligible to apply for public funding through Global Affairs Canada in order to limit level the playing field in these difficult times? Please make your choice now out of this list. And as I said, there will be more options, but I'll ask you to pick 2 of these options. And assuming everyone had a chance to take their pick, I'll ask Nicole to now close the first poll, and we'll take a look at what your priorities are based on this. There we go. It's fairly equally divided among the top priorities, which is increased funding to NGOs and providing targeted support for SMOs. Prioritizing funding for gender equality programs is also high on this list, whereas limiting eligibility doesn't seem to be a solution that is on most people's minds at this point. Now we have a second list, and if the list that we show you now does not include a policy recommendation that you would like to see, please feel free to type that into the questions feature, and we'll make sure to record that as well. Andrea and her team will look at these impressions as she prepares the final version of the official report. So the second part of the question, we're still asking the same thing. Out of these options, which 2 would you prioritize in terms of recommendations that should come out of this report? You're going to pick your top 2 again. Should we call for special support for Canadian organizations and their partners to improve their digital infrastructure? Should we focus on targeted support to decrease the digital divide with a special focus on women and girls, considering the gender implications we just heard? Should we focus on increasing Canadian overseas development assistance from 6.2 billion, the current number, to around 12.4 billion, which would put Canada on track to meet the 0.7 target by 2030? Should we focus on revising public funding regulation to make them more flexible in order to support localization? Or finally, is it most important to maintain funding for non-COVID related programs or projects? I'm going to give you just a few moments to reflect and pick your top 2. Okay, and then I'll ask Nicole once again to close that poll so we can see your spontaneous reactions. Find out which priorities we have. Okay, so by far, our audience thinks that it's important to maintain funding for non-COVID related programs and projects and not just focus on COVID, as Jean also suggested. We have increasing Canadian ODA to $12.4 billion, which shouldn't be a surprise. We all are aware of the 0.7% commitment that we have internationally, and revising Global Affairs Canada funding regulations to support localization is also high on our list. Thank you very much for your input on this. And now we have just about 20 minutes left for our question and answer session. And I have had some questions pouring in. And so I'm going to get started by directing a question to all of our panelists, and we'll start with Andrea, I think. And that is, given that both secular and non-secular development organizations still tend to use relatively paternalistic approaches, and that development research and practice still have many colonial elements today, as Andrea's previous work has shown, is the sector more equal or less colonial now that we see these, reduced travel funds and reduced funds from the global north? And I'll have Andy take that up first.
Yeah, thank you for the question. So I'm not gonna, I don't think this is a yes or no question at this point, because I think what I think we're seeing is how the pandemic has revealed certain pre-existing tensions and problems that already were present, that have become more acute and more noticeable, because now that we can no longer get on an airplane to conduct our monitoring and evaluation or our impact assessments, now that local partners have taken on greater responsibility, we can see how we come up against the wall of financial regulations. We come up against the wall of what is required in terms of reporting, and it's revealing, right? So I don't think it has become, I don't think the pandemic has made it less equitable, but it has revealed maybe what needs to happen in a more clear way. And it's not like this was unknown. This is not a surprise, right? These issues were there before. But I think what the pandemic has done is it has created no other option. It's removed some of the options from the table to say we can't proceed as we were before, because it's physically not possible to do that. So now we're forced to think creatively, and I do believe that this is an opportunity for creative thinking. But we now have to see this. I mean, the other thing that this has revealed, aside from relationships between Canadian organizations and their partners, is how the differential impacts of the pandemic within the Canadian sector and amongst NGOs. And some of the large organizations are struggling, but they are just better placed to withstand this impact than small organizations, right? And so there are also hierarchies within the sector that the pandemic has revealed. And these small organizations who have a less diverse funding portfolio to begin with, who are more reliant on personal charitable donations, who are more involved in education programming, for example, that has stopped. So what happens if they can't carry out the programs that maybe they just focus on, right? These small organizations are more vulnerable than the large organizations, right? And so that reveals a certain kind of hierarchy within the sector that needs to be addressed if small organizations are going to survive this. And
thank you, Andrea,
we need them to survive. Let me just say, we need them to survive because small and medium organizations represent diversity, and we need that diversity.
And the questions that I see flowing in, you actually addressed some of those already, because there's a special concern of the small organizations who would be sort of the first to go. Rebecca, I assume that you would sort of echo the concern of that asker in terms of this maybe a possibility for decolonizing our own sector a little bit?
Yeah, I think it's important to be thinking about this moment and what this moment can bring. I think it's also easier in this context for Canadians to distance themselves from the quote unquote other. And we see that in public support, for example. So I do believe that our close relationship with other people around the world helps us to be more committed to the changes we want to see and committed to the changes we want to be. So it's maybe a moment instead really to reflect on how in the past we have interacted and to really take some time to understand what our partners want and the nature of the relationship that they prefer. So I think, you know, it's a pause and maybe moving forward we can do things better. But I do think that direct collaboration, that person-to-person collaboration is really important for our mutual understanding.
Do you share that, Jean, or do you sort of see it a little more critical?
I maybe just want to move a little bit off of that, the colonial question, and pick up on something what Andrea was saying in terms of the need to support the SMOs in particular. I indicated that CAIDP is private sector, but we also include academia and we also include nonprofits. A lot of our members, there's the big ones like Cowater and Alinea and Burnside, but a lot of our members are small to medium-sized enterprises or individuals, and they are specialists in specific areas. So they are the experts behind the M&E. They're the experts between, and not all organizations can have all of those people. So if we don't support what's going on in the SMO side of things, if we don't keep those alive, we start losing that lens that we need of expertise. I also think from, you know, we're 3 universities represented here, Ottawa, Waterloo, and Guelph, and the research capacity and our ability to develop new approaches, new innovations, which could then be brought to scale by these larger organizations is not being utilized. I don't believe it's being utilized. So we're not an integral part of the discussions that are going around about designing a new innovation or a new approach to, well, we talked about digitization. What's it called? Radio International under WUSC, works with WUSC. Anyway, they have an entire program where they've been doing for 20 years, more than that, I think, of putting telephones and putting communications devices into people's hands. Can we take that approach and then boil it down and see whether or not we can bring it up to scale using new innovations and new technology? All of this stuff just needs to be taken a little bit more. Go back.
Thank you. I have another question that's also directed really to all of you, which says we're all hearing that there's that it's more complicated to do monitoring and evaluation under the current circumstances. But what are we doing to try to address these complexities? What kinds of evidence are we accepting now? How are we navigating this? What are we considering in terms of ethics around this new reality? And once again, I would throw it at Andy first.
Yeah, that's the hard question, right? And that's why I called it sticky, right? You know, so the easy answer would be to say, oh, well, we go online, it's remote, right? We build better systems to be able to do this remotely. But that I think that only takes it part of the way. But I would go back to something that Rebecca has said, is that a sector is based on relationships and partnerships, and we need to maybe ask our partners what it is that they need in order to be able to carry out their work, and ask them how Canadian organizations can support that. And if we start from that place and work backwards, that might give us some answers.
Thank you. Rebecca, Jean, do you have anything to offer on the question of monitoring and evaluation?
I do. I want to add a point on the ethics, because we can't, as responsible professionals, transfer our need for being protected, sitting behind a lovely little computer in my nice little office here, and transfer that responsibility to a local partner to actually take the risk of going out and interviewing or getting into the hands of those you want to interview, the communications technologies. So there's a whole bunch of issues that we really need to be thinking about. Bottom line, though, I think with M&E, your quantitative data may become a little bit less in the qualitative become a little bit more informed. I'm not sure where this will go. Again, this could be something that from a research perspective, what is the best tech, what are we seeing? What's working best? And maybe that's another piece we can look at and then go to scale. But I do know that a lot of my members who focus on M&E are having these discussions constantly. So.
M&E has always been a learning process, and certainly this is a whole new ballgame for us now. Rebecca, did you want to add anything on this, or are you okay to move on?
I guess just to say that, what's the nature of the observations that existed prior to COVID? Is it someone traveling to a country for 1 or 2 weeks to observe? What's the level of investigation that actually happens in a short period of time, if that's the nature of the monitoring and evaluation anyways? And how can you do that in innovative ways by just doing kind of a virtual space, where you're with them, spending full days going through books and things like that virtually. So rather than just expecting reports, that you're actually there virtually and interacting over a longer period of time, maybe similar to the amount of time that may be normally spent anyways.
Thank you, Rebecca. I'll take the last few minutes for a question from Mohammed, who makes an interesting critical point on, or thoughtful point on the issue of localization, which is further supporting local partners may be a good idea, but my concern is that these local partners are partners of various INGOs and are not just implementing Global Affairs Canada programs, but implementing DFID, USAID, EU, UN, and other donor programs, hence already overburdened. So it would be imperative to assess their capacity on the local partners' capacity to start off with. Plus, these local partners are also caregivers themselves and individuals within these local organizations or staff members, perhaps supporting families, elderlies, and other members of the society within their immediate surroundings. So we need to be very cautious that asking local organizations to do more may not give us always the desired result, which I thought brings in an interesting concern. Localization alone is not the solution if we just throw it and make it somebody else's problem because we're so busy with COVID. Any thoughts on this from any of you? Andy, for example?
I would just add to the point. I absolutely agree with all of those observations, but add to the point that also if we're downloading responsibility or shifting responsibility or whatever terminology we're using to describe that, people in local organizations at the end of the day will be working more. And so then there's a question of compensation and fair and equitable compensation that's attached to that, in addition to the other questions that you've raised.
Such a fair point. And I guess I would just add to it that, to what extent are we expecting our partners to learn and use platforms that are different for all sorts of different funding models? And I know we have that same problem in our own platforms that we're using, the learning curve that comes with learning different techniques for different venues that we have online. So if there's some way that we can collaboratively decide on a shared platform so that the learning curve is reduced and reducing the amount of time just to learn each input process. And the other might just be opportunities for more hiring of local staff. And I think that's something that many of our partners have wanted for a long time. Maybe the resources are potentially freed up to do that.
There was just a comment exactly on this point, from M&E, maybe this is the time to bring in, especially for that part, more local partners and strengthen capacities and see that as an opportunity. I think we have time for one more question. And that's going to be, given how diverse inequality and the impacts of this pandemic are, how can we use diversity mainstreaming to better be prepared in the future? I thought, that concept of not just mainstreaming gender issues, but mainstreaming diversity is this, potentially something to be optimistic about. Andy, what are your thoughts about that?
I would connect it to something I said earlier about the importance of protecting the diversity that exists within the sector. And part of a decolonizing perspective is to have and protect multiple perspectives. And so I think we need to find ways to make sure that small and medium organizations who bring these diverse perspectives, as well as our local partners, are supported.
Do you agree, Jean and Rebecca?
Absolutely.
Yeah, and I think, you know, what I'm hearing from partner organizations as a feminist approach allows for this in a way that a gender mainstreaming approach has not in the past. It's opened up the possibility to think in a much more diverse and intersectional way. It's allowing organizations to do this in what they consider a much more socially inclusive way. So I think it is, in fact, a great opportunity, and I think we are moving in that direction, at least as a sector. I think some of the language still lags behind in terms of the way we talk about a feminist approach as women and girls, but I do see some real potential for moving towards a much more intersectional and diversity mainstreaming approach.
I guess I would like to add one comment, and that is picking up on Andrea's introduction. I think one of the failures that we're still seeing in terms of inclusive voices is that the Indigenous peoples in the countries that we're working in are not represented well by what we're doing. So as we go out and we're undertaking these M&E programs, are we actually hearing from all of the voices we need to? So I think there's a lot more work that needs to be done in that sense, in Canada as well. Absolutely, but particularly overseas.
Thank you, Jean. So I have been, as comments and questions have come in, there were actually quite a few, more comments and reactions to the recommendations, and I'll be sure, of course, to forward those to the authors of the report. I got reactions about, well, I think things like recommendations number 4 and 5 in Andy's list, which related to restructuring funding regulations and focusing on smart digital investments, for example, seem most realistic to many. But I think it's also been interesting to see the reactions and the priorities, the spontaneous priorities after hearing this report. So I'm certain that will flow into the final version that goes into this report. But this already takes us to the end of our allocated time, and I'm German, so I want to make sure we stay within our allocated time period, because I know we all have other things to do. But I do want to thank everyone for a lively discussion. Thank you for the questions that were submitted from the audience. Thank you for your patience and attendance. And thank you to CAIDP for hosting us, especially to Nicole and to Noel for the logistical support. Everything worked smoothly despite fire alarms and despite thunderstorms. So that's good to know. And thank you, of course, very much to our panelists, Andrea, Rebecca, and Jean, for your insightful input. I really appreciate the opportunity to get this conversation started. I know that there's more research even in the works. I look forward to seeing what comes out of this. And of course, as we continue this conversation and as we continue to navigate the global pandemic together. So on behalf of everyone on this team, thank you very much for your attention. Stay healthy, everyone, and thank you for tuning in with us today. Thank you.
Bye.